Make an announcement of the audio video recording of this meeting being done by the North Street Association, to Ruth McGrath. And I think you all have the minutes, right, for February?
Yep. And
I read, yep.
Okay. I
I'll
would
make
like,
a motion to accept the minutes, approve the minutes.
all in favor?
Aye.
Okay.
And thank you, Ruth.
I hope you would like-
Wow, thank you both.
Greatly,
Thank
greatly.
you.
Thank you both.
Lucy, you can step right up to the podium, please.
Step
What-
right up.
Why don't
Once
you
you get
grab
a chair, come right up in the front here.
Yeah, go ahead.
Yeah, let me get you
Yeah.
up. You got that?
Come on closer,
Oh,
so I can hear you.
oh, so you, oh, see.
You're like Ray, right?
Yeah, right.
Oh, jeez.
I didn't bring one for you, I'm sorry.
That's all right.
That's okay.
That's fine.
Lucy, I want to thank you very much for being
Thank you for
here
inviting me.
again.
I
And
love to talk about tapestry, although Bill could probably do it almost as well.
No, only certain dimensions of it.
The parts of it, right.
Okay, I know you're gonna talk about Tapestry Health and their program description, and you're gonna do that, whatever, for 15-20 minutes. Then you're gonna talk about Tapestry Health and mass healthcare reform, which is a real good one, and giving us the opportunity to ask you questions.
Okay, well, I'm not
And you
sure-
do know all the counselors? Okay.
So Tapestry Health is a local health and human service agency. We have been in existence since 1973, and so we're celebrating our 40th anniversary. Started as a family planning services agency in Northampton and Amherst, and as money became available for subsidized family planning services for low-income women and teenagers from the federal government, the services expanded to other cities and locales in western Massachusetts. And at this point today, we have sites in all 4 counties of western Massachusetts. So we have a site in Greenfield, we have one in Amherst and Northampton, Holyoke and Springfield, and Pittsfield, North Adams, and Great Barrington. Some of the sites are just part-time, but Northampton, Pittsfield, and Springfield, and Holyoke are almost all full-time. So we actually, Northampton site is open every day except for Tuesday. And so the agency started as a family planning program, and I'll come back to that because that's the one I know the best. And but I'll also tell you some of the other services that the agency provides. But I'll be fairly brief about some of them because they're not all provided in Northampton. And I know that's what you hear the most about. But Tapestry also provides WIC services in the Springfield area. We used to have them in Hampshire County, but the contract now is with Community Action, and they provide the WIC services in Northampton. But we used to. So we do that in Springfield. We also have a lot of HIV and AIDS case management services both in Springfield and Greenfield. We don't do case management, HIV case management in Northampton. In Springfield, we also have a program called the LaRose program, which works with many different segments of the population, but a lot of them are homeless. And we focus, and some of them are just released from jail.
What did you call it?
It's called La Voz, L-A-V-O-Z, 2 words, and it means the voice in Spanish. And we work mostly with HIV prevention, and other STIs, but mostly the money is mostly targeted toward HIV prevention. And so that's what we do with those populations.
And that's only done in Springfield?
That's only in Springfield. and then in Northampton, besides the family planning program, we also have, and I know you all know about this, is the needle exchange program, which is located just across the hall from my program, which is at 16 Center Street on the 4th floor. The administrative services used to be at the Center Street building, but 10 or so years ago, they moved to Springfield. What am I saying? To Florence, sorry.
Yeah.
Almost like spring,
Almost.
Yeah.
almost
Florida.
as far.
Yeah, really, sometimes it seems that way, to Florence. So at the Needle Exchange Program, it's a program created by the state, I don't know, 17 years ago, something like that, very many years ago. And it's designed to provide 3 needles for people who inject drugs so that we can minimize the spread of infection that gets spread by sharing infected needles and also having a few of them thrown away on the ground.
I have a question.
Sure.
Of course, my wife thinks that needle exchange program is probably the best thing that's ever happened.
Many people.
Yeah, and she's been an OBGYN nurse for 25 years, but anyway, maybe longer. Anyhow, how do you go about exchanging needles? If you were a drug addict, you would just go to,
You go to Tapestry, you take your used needles, the ones you use to shoot your drugs.
Yep.
And we give them clean ones, unused, clean ones.
One for one exchange.
One for one
yeah.
exchange.
Is there any paperwork involved or anything such as that?
No, well, there's a minimal amount of, there's paperwork that we have to do. The
Yeah.
client, mostly, it's anonymous.
Yeah,
They get a number and a card that shows that they've been enrolled in the program. And so that if they're caught
Busted, yeah.
busted, it's clear that where they've gotten the needles or,
okay.
And
so.
plus, I think I remember when I went over there, when the needle exchange just first came out, and I think Counselor, you and I were counselors then. And I support it 100% and always will. We had a very young youth on our ward, and thank God for Tapestry Health, because they put her back where she should be, okay? And if I can recall in the way it was explained to us, say as an example, I go there and I'm using drugs and I use a needle. It's to get to know who I am by the visibility each time I come in. But, and I think people need to understand, it's just not the walking through the door. It's what the visibility is of having caseworkers and also, which is very important, and also medical staff. This way they can, whoever comes in through those doors, they get to know them, they know what their problem is, it doesn't happen overnight, but then they are able to have a social worker or whoever who will take over that individual. And that's when they start giving them the counseling and the care that they need. Is that correct?
If that's exactly right. So it's not just going in there, say, give me my needles, and out they go. And that is sometimes what happens, but they go repeatedly. And so they do get to know the staff gets to know them, and they develop trust, and then very, very often, people will say they want help. And they want to be referred to detox or to counselors or whatever.
So there's as much dialogue as the client will allow.
Yeah.
Oh,
Yeah.
yeah. And of course, it's like any addiction. They can say they want detox and they can go, and then they can be right back where they started a few months later. And it may take many times to go through the process before they actually can stay clean. But that contact with somebody who knows where they're coming from, isn't judgmental, gives them what they need to help prevent the spread of infection, shows them how to clean, to bleach needles and to use safely to be as safe as possible. So help them stay alive
Yeah.
until the time when they can, if they can't ever,
Yeah.
get
The-
clean and stay clean.
Yeah, the model's called harm reduction.
Exactly.
Yeah.
So the idea is to actually reduce the potential harm that's associated with particularly intravenous drug use and transmission of diseases that go along with that, but also issues of overdosing, and also the social and physical problems that come associated with addiction. And rather than ram it down people's throat, this is a point of access where people feel comfortable and not judged and no one's gonna proselytize, you don't have to go through a process, and you come to your sobriety if you choose to do that on your own terms, in your own circumstances. And I think the most telling point, Lucy's probably gonna get to this, but is the fact that it's worked. It works amazingly well. The reduction of HIV transmission, particularly in this catchment area that's been using that, and the reduction of other STDs, but also the people who've gone into rehab. There are people now who own businesses in this community that used to be needle exchange customers, and that has been remarkable. And there was all sorts of problems that people predicted would happen with the establishment of the needle exchange, and it was going to, you heard the fights revisited in Holyoke, for instance, where the discussion was that this is going to encourage people to become drug addicts, which, it's an absurd premise. No one becomes a drug addict for the prospect of sticking a needle in their arm. The needle is the most efficacious way to get high, so it's not, and my argument to former Mayor Mike Sullivan once upon a time was that I said, you own a bar, you're required by state law to clean the glasses as you serve alcohol to people. This is the same thing. It's the same idea. It's that you may not be encouraging alcoholism. What you're trying to do is discourage the transmission of disease. So Tapestry was very brave, and the community was very brave,
Yes,
actually,
it's
when
totally.
the program was
Counselors,
established.
the mayor,
Yeah.
the police department has
Yeah.
to be
big
a
time.
big,
Yeah.
has to be in support of the program. And point of fact, there are only 4, well, now 5 needle
Yeah.
exchanges in Massachusetts.
At the time, when you first started, there was only one in Provincetown, right? And I
Right,
think there's
Provincetown, Cambridge, Boston, and Northampton, and now the Holyoke one, which is contested and may
Yeah,
eventually
may
have to close, I don't know, but at the moment, it's still functioning.
Well, I think it's a hell of a good program. I just didn't know just
Yeah.
exactly how it was administered, how it
Yeah,
worked.
sure.
And I would never make an IV drug user because I'm petrified of needles.
Right.
I can't.
Don't feel bad.
I mean, I'd rather be stuck with a knife than have somebody stick me with a needle. I'm telling you, just
Let alone do it to yourself.
oh, geez, yeah. So anyway, but I'm just kind of
If you were
curious.
addicted to drugs,
Yeah.
you would probably be able to
Right.
get over your fear of
Oh,
needles. If that were the best way to
The
get
allure
out.
of heroin is sometimes
It's-
overcomes people's dread fear
Right.
of needles,
Yeah,
because
right.
as your high diminishes when you do it through other means,
You have to.
and then you
use it,
realize
right.
that the best way to get your jolt is to introduce
Yeah.
it directly into your bloodstream.
And it's a serious problem. I mean, heroin, I don't know that much about drugs, but heroin is almost cheaper than marijuana.
Yeah.
You can get heroin anywhere downtown, anywhere.
Well, I've
for
got
a
employees-
lot
yeah.
less money than a lot of, like a nice bottle of wine. I mean, it's very inexpensive, so, I mean, that perpetuates, that makes the problem,
Yeah.
you know.
I've actually had 2 employees that, one came from Bob Garrett, the sheriff, and another one was another kid, and they both died of the heroin.
Well, that's another thing that Tapestry's done. We're a demonstration project for something called Narcan, which is a drug that gets, anybody can administer it. You can, as a drug addict, if you know you're beginning, if you suspect that you've OD'd, you could administer it to yourself. You could administer it to an employee or a cousin that you knew was ODing. It's very easy to learn, it's just inserted into the nose
it's
and it can
instantaneous.
prevent, what?
It's instantaneous.
You
Yeah,
put
and
it
it-
in your nose,
An inhaler, it's a,
not a needle.
Nope.
no, it's like
No.
doing those
It's a little-
old ammonia
oh,
caplets that
oh,
they used to do.
Mhm.
And it literally jolts them, it's a stimulant, it's a direct stimulant that, because when
If
you're
you-
going into an overdose, you're, everything's stopping.
Shot in the-
Everything's going to sleep, basically.
You're talking like smelling salts.
Well, sort of, it's more
A
elaborate.
little bit.
Yeah.
It's a
Yeah,
little
more elaborate, but-
and you need to, yeah. But
Where do you
it's-
get that?
You can get it at Tapestry. We give it to both the users themselves, and we encourage users, friends and family, to also have some.
This whole line item intrigues me, I just, how it, if you've ever been close, I've been close to a couple of people that have really could have used this, and,
I never heard of it.
No, it's relatively new, relatively new.
and I know we're getting a little bit off the track here, but I gotta ask you another question too. In the last week or so, you're talking about, at least two instances now of infant cures.
Of HIV?
Yes.
Yeah, I've heard of that. Good
That's
news as
doing
far as.
Yeah.
retrovirus, giving them large doses of retrovirus from a post utero. And then also there are 15 cases in Europe, I think, where they've actually had an adult regression of HIV. So
Yeah.
that's
And it's very
huge.
encouraging.
That's
Yeah.
It's very encouraging. I mean, the drugs that are available now, that many people take and can take for years, you know, they're not cured,
Yeah,
but it certainly holds the
Seems to
the
keep things
disease
at bay,
in
don't they?
remission, for years and years. People with very healthy, you know, lives, you wouldn't, you know, they don't know, you know, except
Yeah.
for the drugs they take, they wouldn't know they were sick.
Hmm.
And it really keeps, you know, very much keeps them healthy, but
I
of
think
course it
they're
doesn't cure. but
coming a long way.
They've come a long way. And, you know, but of course the flip side is that, people think it's not as scary or as devastating,
Right.
which of course it isn't. So people, I mean, as a result of HIV, there was a very big increase in use of condoms and other protection, and although that's still with some young people who are just starting out their sex lives, it's sort of become part of it's becoming natural. It's sort of like seatbelts. You know, my daughter would never get in the car without seatbelts. She probably, you know, have a new relationship without using protection. But that's much more common with young people. People in their 30s and 40s, it's not the case because they didn't grow up that way. But because it's becoming less scary,
yeah.
people are not
How many-
protecting themselves as well.
How many people would you say, or youths, that come to the agency that are reaching out, who are on heroin and who need help? How many would you say on a weekly basis that you are helping?
Well, I mean, we exchange thousands of needles every year, and that, you know, could be several hundred people exchanging multiple, you know, a dozen every few days. I mean, it's amazing how much people have to inject to keep their high, and to keep feeling okay. And of course, every time they start coming down, they feel horrible. So the only way to change that is to inject some more. So people use a lot of needles. So those thousands and thousands and thousands of needles that we exchange, you know, could represent just, you know, several 500, 600. I'm sorry, I don't know the numbers, but I can find out if you want me to.
Oh, that's okay.
You know, I can ask Tim what the latest numbers are. But,
Say they come to you,
but
your
all of them
agency.
are helped in
Right.
some way.
and then eventually, like, they will suggest of where they could go for rehab. Where would they go for rehab? Like Cooley Dick or?
There's, I'm not sure where all the beds are. There's some,
Franklin County.
there's, what?
Franklin County is.
Yeah.
There's Carlson on
There.
Springfield, part of Bay State, I believe.
There's some in Springfield.
There's
and-
private ones that are very expensive.
Yeah. Mhm.
And most of the people who are availing themselves of the exchange program probably aren't in that demographic
Right.
for them.
Yeah.
And there's, in the
Some
state,
of them
unfortunately,
would be
it's less and less subsidized beds for rehab and programs. There used to be waiting lists.
Well, there probably still are.
Yeah.
But we've transported people to, if somebody comes in today and they say they want to go into rehab, and there's nothing locally, we transport them to Worcester. I mean, we're
Yeah.
known to do that. It's not a regular occurrence, but, we can do that, federally. And we do work very closely with, the other treatment programs in the area.
The state does not assist so much anymore in financial aid for these rehabs, as they used to. I mean, they used to have quite a program.
Everything's on the decline in
Yeah.
terms of state subsidy.
In everything, not just in that, yeah.
For our family planning program too.
Yep.
We have lost state funding, and the federal funding, of course, is very tentative,
Yep.
very tenuous, given the makeup of the House of Representatives. It's threatened all the time.
Yeah.
So, I mean, it used to be very secure. It's called Title 10, which is family subsidized federal family planning money.
You don't know from minute to minute.
Right, right. And we've already received a cut this year, and we don't know yet whether there'll be further cuts. And
How
we've
much
also
is
received
it?
how much, I don't know that either.
Well, there's sequestration, which will also have an effect.
That might have an effect, it doesn't directly affect the family planning program, but it could indirectly affect as the money, is cut from other things. It would also be-
Well, I just got my,
I've never seen Tapestry Help come in and apply for a CDBG grant. Do you
I think
know why?
we used to many years ago for some help with disability compliance, ADA compliance, years and years ago. I'm not sure why, there's not much money in the service realm
Right.
for CDBG. I mean, there used to be more,
Yeah.
but it keeps decreasing, if it even exists anymore, I'm not really sure. It's a very small amount.
We just
We just did
approved
a-
very small grants
Yeah,
for,
it's very small.
yeah.
I just got my invitation to Jim McGovern's.
Oh,
We'll get
okay.
together at the Hotel Northampton with Deval Patrick,
Uh-huh.
and they invited me to spend $1,000 to come talk to him, or $500 or $250.
All of us.
Keep talking for free by going to his
400.
office.
Yeah, that's right, that's what I'm doing, I'm going to his office.
We
I'm not,
have a city council meeting that night.
yeah, that's right. 1,000, yeah.
Right,
I don't
Yeah.
think we were their target audience there.
yeah, probably not.
No.
Anyway, so Tapestry, so the family planning arm of the agency works in a similar harm reduction, with a similar harm reduction model, in that when we first opened, we were also accused of promoting promiscuity and promoting sex, which again is sort of the same silliness as people accused in the exchange. I can't tell you of any new client that we see, how many of them are abstaining before they come. Well, I could tell you, like 1%.
Yeah, yeah.
They're all, most of our clients come to us because they're having a pregnancy test. So clearly they're not, we're not forcing them or promoting sex.
Yeah.
But, in any case, our model is we're non-judgmental. We want services, doesn't matter what age you are, the state protects, the state constitution protects family planning agencies to allow us to give health, family planning, any kind of reproductive health services to anybody who comes, and it could be any age. I mean, I've never seen anybody younger than 13, and that's very uncommon, but I think we see that more in Springfield and Holyoke, but here in Northampton, that's the total exception. Our mean age is, 19 or 21 or something like that. I mean, we certainly see 15, 16-year-olds a lot. But we do a lot of preventive care. We do pap smears and breast exams. We screen for sexually transmitted infections and other kinds of vaginal infections. We would make referrals if we need to for further specialist care. We do birth control prescriptions and counseling. We provide the emergency contraception or the, so-called morning after pill, but we don't call it that anymore because it works for 5 days after an unprotected intercourse. So, we don't call it morning after.
It would also work in the afternoon,
It would.
yes.
Are you like with Karen Jarvis Vance? Do you work with them?
I worked a lot with the high school and the health services department,
They're
especially
great.
when I was on the school committee. I haven't done as much recently, but we've certainly worked together with them. So we go to the high, if we can, and people invite us, we go to schools to talk about birth control and human sexuality and prevention of STIs. Oh, we do HIV testing, counseling and testing. We have a rapid test where you would learn your results in 20 minutes.
Mhm.
So we get a lot of
I'll bet you do.
takers. And if, the state wants us to promote, and we do, just sort of and we have a lot of people who are, we call them the worry well. They just want to be sure that they don't have any.
Yeah.
They're in a new relationship. They just want to make sure they're not, they don't have any. So they come, but most of them have nothing.
Yeah,
I remember way back when Lucy had just moved into our ward, and we had a big function going on at Leo Master's Farm for all the
Oh, yeah.
families in Ward 6 and the children. So she set up a table, and I set up all her brochures and that, and people were so impressed because you just heard her say about 5 minutes ago how people felt, oh geez, they come in there and they let them take needles and all this stuff. With that and those brochures, it really helped a lot of people to understand what tapestry health is all about. And I think it's fantastic. I've always supported it, and I always will.
And we appreciate it. I mean, we need the support of, local people, and both financially and just in terms of policy. And I'm so really just have to say that Central Chambers, which is where our offices are, and especially for the regarding the exchange program, they've been so supportive. We couldn't do it without them, because it just makes a huge difference.
Is that where your office is now? I remember way back, I think we had they had an open house and you were
Yeah,
able
we
to.
occasionally do.
Do you? Could you let us know?
Of
when you're
course.
having a meeting?
Of course. And,
For 40 years, I suspect you guys will be doing
so
something.
we have some events planned
Yeah.
for this year. I don't know if open houses will be part of it, but.
I thought I had seen one of the new vehicles that you had out there
Oh,
last year.
We have a van, that's right, thank you for reminding me. The agency has a huge mobile van that we take, to the university, all the colleges and schools around. And we've been invited to do testing, mostly we do testing. We're doing hepatitis C testing as well, which is fairly new. But we've been doing HIV testing for a long, long time now. And we can do it wherever, we take the mobile van wherever we want to. Wherever we're-
That van is beautiful.
the WIC thing, is that federal?
It's federal, but it's funneled through the state.
But it's
We
all
get the money
federal money.
directly from the state. I think there's some state match,
Yeah,
but I'm not sure.
and how has that been doing?
Wickham is amazingly solid and
It is.
stable. It doesn't have the same political, fireworks associated with it,
Yeah.
so, it doesn't, it sort of stays under the radar, and because it's nutrition and, supplemental food for babies,
Yeah.
sort of hard to fight.
I mean, who could,
against
who could bitch about it?
that. Right, exactly, it's sort of hard, exactly, that's why.
I wouldn't challenge, and they could find a way.
They could. I mean, if they want to cut supportive programs for low-income people, they could do it.
Right.
Or you know, they could target it just as much as any other
Well, I mean,
program.
they're
even
going
if it's
after,
non-controversial.
they're going after food stamps now, they're going
Yeah.
after all food
Right.
subsidies and programs.
Mhm.
Those are all being targeted. And the thing about sequestration is the defense budget increased about 30% in the last, I don't know, 5 years, 10 years. All the social service programming actually were either pretty much level funded or cut. So the sequestration 8% cut across the board that affects defense is 8% from this 30% glut that they already had. And it puts everyone else in social service program below level funding. So that they're actually, it's an even more
Worse.
harsher cut
Right.
to social service
We
programming.
haven't had an increase in funding on the federal or the state level in the family planning program for years. So, you know, it's essentially, I mean, you know, the same thing as your budget and the school budget.
Yeah.
Level funds mean less,
Yeah.
because.
Level funding is a cut.
Everything is going, all the expenses are increasing, so, yeah, I don't remember you.
Under the WIC,
Mhm.
with the fuel assistance,
Mhm.
are you connected
No.
with?
I mean, we don't do any of that now.
They're doing,
If it's in-
CAC's doing that.
Yeah,
That's
right.
it.
Yeah, so that's probably out of date. It's kind of hard to keep track, or.
Well, this is 2 years behind the
Yeah.
times.
Probably.
Yeah. I got this one from you last year.
Did you? We can't afford to,
No.
Who are coming out for their 40th anniversary?
Yeah.
You can't afford to print stuff. So,
Are they doing anything for the 40th anniversary?
well, we're doing a number of different programs throughout the year, so.
You need an MC to.
She's volunteering me for all these
I
events
know.
that this is not
Don't
the
worry,
fourth
if we
one.
need one, we know where to find
They
it.
know where to find it.
We don't need to be reminded.
Yeah, I can shave my mustache off for it. My wife wants us to go, so if you want, we can make money off selling them my
Oh,
mustache.
that's funny.
I'll shave it, I'll
Hey,
shave it.
oh, well, there you go.
There
Could do that as a fundraiser.
you go.
So one of the questions that you asked me, Marianne, was sort of what some of our challenges are, and of course, you know, funding goes, it almost
Where do you
goes without
start?
saying, right? So that's just always gonna be, and always has been, always will be an issue. But sort of related to the funding is the new health reform laws in Massachusetts. And as wonderful as every one of us, I'm sure, and expensive maybe, but as wonderful as the principle is, in terms of covering people with health insurance and encouraging them then to use their health insurance to get preventive care, to perhaps, with luck, prevent more serious things that cost more money in the long run. We all support the new health reform in Massachusetts. But it has presented a challenge for Tapestry in that some of the health insurance companies in the connector plan won't contract with us. They, for whatever reason, it could be political, it could also be just financial. They want to have as few places to contract with, and since we don't do everything, they'd rather contract with Campo B, for instance, because, they do reproductive health care from A to Z, is, from prevention to delivery, and post that. So, and we don't do all that, so they want to minimize the, and so to some degree I do get that. But, so we can't bill for services or, if they won't contract with us, so we can't bill Fallon, for instance, or Alfred Pilgrim. But we have increased a lot of our health, a lot of our clients do have health insurance. But it is amazing, so when the state tells you that that 95% of residents are insured, that is slightly misleading because about half of ours aren't.
Yeah.
And the reason that's the case is that teenagers and some people who want confidentiality for other reasons can't use their health insurance, because if your child has your insurance and they go to Tapestry, you will, as the subscriber, receive the EOB, the explanation of benefits, that says that Johnny went to Tapestry Health, and Johnny don't want his parents to know.
Yeah.
So they have to use our state funding which is decreasing. And the state threatens to take away because they say, well, wait, you know,
Right.
why-
Yeah,
no
yeah,
one,
to that.
everyone
Right.
has health
Sure.
insurance, so what do you need subsidized care for? So we have that issue. We have, I can't tell you how many people come to us and say, well, they come to us, they don't have health insurance, they can't afford it. They maybe will even get it through their employer, but they can't afford the employer's premiums, so they
Yep.
choose not to get it, and take the penalties. So those people who say, you know, they don't have health insurance or can't get it, and then they decide to get it, and then they go off it, they lose their job. I mean, there are people who go on and off, on and off. They leave us and they say, okay, I'm going to a real doctor now because I have health insurance, and 3 months later they come back. Well, I lost my health insurance because they lost their job, or they decided it was too expensive and they stopped paying the premiums. So it's a challenge. I mean, clearly it's helped thousands and thousands of people from Massachusetts, and I assume lots of people in this catchment area. And it has enabled them to get health insurance and to get care. And that's,
So,
don't
in-
need from us to do
in
that.
the funding aspect, it's a continuous battle.
It's a continuous.
Kind of, you find yourself putting out fires here and there, trying to, yeah. But-
So we're just an interesting look at the health insurance law, which we, as I said, we totally support.
Are you guys advocating though for changes in the law that allows for, particularly, I mean, I'm particularly concerned about the one point that you bring up, is the absence of privacy and discretion.
Well, we talk about it all the time at the Department of Public Health, and with our legislators. I mean, partly to make sure that our delegation supports continued funding, but also to bring up a point that is a glitch to some degree.
That's a significant glitch, I think.
Yeah, it is.
I think that's
And, you know, the state could, if they did something, and they assured teenagers the privacy, if they assured us that the parents would not, or the subscriber would not get an EOB, and we could then convince the clients or the teenagers or whoever wants that confidentiality of that privacy, they would be able to use their insurance, which is cheaper in the long run for the state. You know, yes, they're subsidizing that insurance, but you know, the Health New England and Blue Cross Blue Shield are also subsidizing it. So it would be cheaper in the long run. But so far, they haven't done anything about it. It's extremely. It's in Mass Health is, you know, Medicaid.
Right.
That we have a lot of young people on Mass Health whose parents have Mass Health, and they won't use it.
Yeah.
Why?
Because their parents will get
They'll
explanation
get
benefit
yeah.
that says that they've been to Tapestry.
So my rejoinder to that would be,
He's been quoted as rejoining all over town.
And what would it be? What would your rejoinder be?
my rejoinder would be, maybe their parents should know what the cars they're doing.
Well, you know, that's, and I think,
In the
I would
perfect world,
argue with
we
that.
argue for that, we support that too.
But I think-
know, I get
think-
it.
But the fact is that, say, you're living in an abusive household, for instance.
Oh, yeah. Yeah.
And say, for instance, you're a girl
Just
and your
today.
father has molested you.
Just today, we had that.
And then you don't have, there's nowhere you can go with confidentiality, knowing that it won't get back to the person who's your abuser. And so that person, what does she do?
Yeah.
What does she do? What's left to do are usually acts of desperation and create an even more hazardous circumstance for her. And those are the people that need the services of Tapestry more than anything. And you know, kids keep stuff from us all the time, and it's on us to figure out what it is. It's a cat and mouse game. We played it with our parents. Our kids played it with us. The thing is that I think the state, I mean, people's concerns is the state, you know, are they going to be complicit in that duplicity? And I think that I would look at it more passively and say that the state is taking care of citizens, and then it's upon the parents to figure out, you know, work with their children, to be able to have access to their children, understand what their children are doing. And the thing is, it's not like what they're doing is helping people, so they're not either with pregnancy counseling or, you know, protection or harm reduction. If your child's using heroin, that's the bigger secret as opposed to your child using the needle exchange. Or, you know, that's the bigger issue is the fact that you have a child who has an addiction cycle and you're not aware of it. Of course your child's not gonna share that with you. And if they're not going to protect themselves, the only way the parent's gonna find out is after that child's died. And that's a bad time to find out, I think. I think that's a bad time.
Or if they OD
Right,
and they're ending up at the hospital
Right.
or something.
Or they find out that their kid has, you know, sexually transmitted infection. that
Right.
they don't live with for the
Exactly.
rest of their
Right.
lives.
Yep.
I mean, it's, I mean,
Put it
you
all
know,
away.
his, you know, Bill's example is an extreme, you
Yeah.
know, of an abusive,
Mm.
person in the family.
Mhm.
But, you know, there are a lot of kids who just, you know, even good kids,
yeah.
who have good relationships with their parents, just want them to know that they're
Yeah.
sexually active.
I was just gonna ask you that.
You know, they just, it's something they don't wanna share,
Yeah.
whether, you know,
Like my
Right, they
sister,
wanna
hey,
keep it privately and try to
Yeah, that's
handle it
right.
themselves, and that, to me, causes a big problem.
my sister-in-law, she heads up the DSS office in Springfield. And,
Oh.
yeah, so,
Oh my
I get it, I
gosh.
really get it, you know?
Yeah.
But it's hard for me to grasp that, coming from like, this perfect little household, you know, on North Maple Street all my life.
Mm-hmm.
And you think, what, and I go, Jesus, you know, it's really happening.
we report
It
abusive.
really happens. Hmm.
Lucy, we
Difficult.
wanna
Lucy,
thank
thank
you
you very much.
very, very much
My
for being
pleasure.
here again,
My
and
pleasure.
please keep in contact with us. Let us know of any functions that are going
Okay,
on,
we will.
and I highly recommend, if you do any fundraising, Bill.
You mean he's got a deep pocket?
There you go.
No, he'll be your MC.
The fundraiser, we're gonna shave his mustache for $1,000
As I said, all
for
I
a
have
worthy
left-
cause.
I can only donate my dignity, that's all I have left.
Shave it for
He
free.
does an excellent job at it.
Sounds good to me.
Yeah, I know Brad would be down with that.
Yeah.
I saw it for the first time, a bumper sticker that said, "I started with nothing, I still have most of that left."
No.
Yeah. That's
Good
pretty
point.
much where I'm at.
Cheers.
That was hilarious.
You guys can
All
bring
right,
up
thank you
chairs.
for
We're
inviting
gonna
me.
bring 'em up.
Thanks, Lucy.
Thank
You're
you.
welcome.
Get prepared
Yeah.
for tonight and tomorrow. Be
Everybody bring a
putting
chair.
out hydrants.
Randy always does that.
I was gonna get up and
He's
get
a
your
good
chairs for you,
citizen.
but
Brandy's obsessive about shoveling.
Our
yeah.
next door
Here is
neighbor, Ken and his wife, I was out there doing one, they said, we are
What's
not
up?
letting our counselor do this all by herself. She was out there
Got through the parade
helping
okay?
me.
Fantastic.
It was fantastic.
And next year.
Right here, any one of these chairs, we don't care.
Reenact,
yeah, he can use a good chair.
Just bring it out.
Right here.
We're gonna bring it out.
More, yeah,
Huh?
that's
I'm gonna
more
bring it out.
appropriate, I suppose, more
Here,
appropriate.
move that.
Exactly.
How are you,
Put it on
Brad?
the other one.
The parade was great.
Thank you, Lucy.
It was a ball. It really was.
We
Big
got
fun.
so much, we got so much recognition there, it was unreal.
Fantastic.
Hoyoke isn't a
Thank you,
bad
dear.
place.
Yeah,
Really, is it?
way behind
Grab a
Northampton
chair.
now.
Wow.
Okay.
That's Norwood.
Oh, okay.
You're home first.
Yes,
And before you even get started, thank you guys for everything that you did in that parade.
Fun.
Yeah.
Well,
Fantastic.
With, actually is.
because Zilla didn't run me over, so that was.
Well, Gene pointed out it was the best
We kept
representation from the city of Northampton for a long time. We have, there's been some pretty sparse seasons with it, like 8 of us walking.
when we started, Bill, we were so far behind, and we were with you,
Right,
but it was
Right.
so huge,
right,
Absolutely.
we couldn't even see it.
right.
You see?
Lots of happened this time. With
That,
the-
And we missed you too.
that was a big, big parade.
Yeah,
I was never so surprised to see so many people. Get down by the
Yankee Peddler.
Yankee Peddler.
Oh, yeah, that's
It was
like that all the time.
Always a crowd there. Yeah, it was
Wow.
good. It
apparently,
was great.
you guys were telling me there was a big fight there.
Yeah, there
Well,
was a
Tommy
fight.
Pease was telling me, because I didn't see it when we
I
walked
didn't
by.
either.
Well,
A
it was,
couple of guys had a discussion.
it was starting out,
I think they
but
were, you know.
They were using
teetotaling.
sign language,
Right,
right?
yeah.
there was three cops there, it was a little altercation on the left-hand side as we were
I
walking
didn't see
down.
Yeah,
I
They were
missed
going
it
at it,
completely.
guy in a white t-shirt, I
missed
saw it.
completely.
well, a lot of hand language, but
Yeah. Oh, I missed it.
I guess
Okay,
it was
Steve.
all right, you know.
Steve, I want to thank you very much for being here. And I know the counselors are probably going to have a lot of questions for Steve because I know you have some questions to be asking. So we're introducing Steve Connors, who's our Veteran Service Director of the City of Northampton. And I'm going to, also we have the Veterans Council here, which will come aboard shortly. But I want to let you know, you are being audio, videoed of a recording of this meeting, okay? And that is by the North Street Association, and Ruth McGrath is doing it for Adam Cullen. Okay, Steve?
Okay, I gave you just a little outline of what I'm gonna go over. I think I laid yours up there.
Thank you.
All right. The first, and it came out today, you probably haven't gotten a chance to see it yet, but the mayor's office released a, what do you call that? Press release.
Yeah.
Press
A
release.
press release. Last week, the Lieutenant Governor's Interagency Council on Homelessness had created a steering committee that has been working for about a year, and I have served on that committee. And we unveiled a 3-year plan to prevent and end homelessness amongst veterans. And this release just kind of says, I was quoted in the press release, I don't need to repeat it, you guys can read it. Basically, we're hoping to reduce the numbers by 1,000 in the next 2 years. And I do have the entire plan here, if anybody wants to look at it later. It's online. I think the mayor's office also sent it out in an email with the plan itself that I've been on. And I guess I do have to read it just so you know why I was on it. I'm quoted, "Whether we serve in our Commonwealth's major cities or in the most rural small towns, we know there are homeless veterans or those living on the edge of homelessness that we have a duty to serve. The MVSOA, which right now I'm president of, is fully supportive of the Patrick Murray administration efforts to end homelessness, and we are committed to partnering with the veteran service organizations and providers to make this vision a reality in all our cities and towns." My part in it, whether I was president or not, I was going to be serving on that committee. As a matter of fact, I started before I became president, because I have a district that has very rural communities, and we have homeless people out there. And we're not all in Springfield, Boston, and Worcester. So that's why I was on the committee, and that's my perspective that I brought to it. So, like I say, the mayor's office, I think, sent it in everybody's inbox, so you'll have it. It was a lot of work to develop, and the implementation of it is going to begin the first week of April. I have a meeting. My priority is, under the category, they'll talk about 450 chronically homeless veterans. My take on it, statewide, my take on it is, it's important that we give them, either we get their name or we get an identifying number, and it's put in the system. What it's asking us to do, which I already do anyways, is work with the continuum of care that exists. That just changed over. You probably know that the city of Northampton used to be the chair for the 3-county one, which was Franklin, Hampshire. In all of Hamden County except for Springfield, they had their own continuum of care. That's been realigned. We are now Franklin, Hampshire, and Berkshire, and the lead is the Hilltown CDC. Peg is no longer in charge of it, and Springfield has incorporated the rest of Hampden County, so it's been realigned. I work with that, I worked when Peg had it and the city did it, and I continue to work with the Hilltown CDC.
And for the record, I know Peg Keller's what we're talking about.
Yes, I'm sorry.
Just for the
Peg
record.
Color.
Yeah.
So I continue to work with that COC, but we need to identify these people by name or number, so that in 2 years, when we have come, I mean, if we're successful in housing all 450, great. But if we do a point-in-time count in 2 years, and there's still 300 out there, but we've housed 400, I want it to be recognized, because some things that could happen that are gonna change that count in 2 years, other people may have fallen back into it and are not in the last point-in-time count. Other people might, their classification might change, because it depends on how many times you're homeless in a couple-year period. So if they fall in again, they will qualify under that title. And finally, there are people, veterans, who travel around all over the place, trying to find whatever they can get, and whatever services they can get. And Massachusetts should be proud that lots of times they'll come to Massachusetts, even with the cold, miserable weather, because we have the services to meet their needs. So if we house 400, but yet we get a count in 2 years that there's 300 chronic, it may not, it won't be due that we didn't succeed. It may be that more fell into it and more have come in.
So the reduction
And that's
goal of 1,000,
Right. The reduction of 1,000, both chronically homeless and
homeless.
those that are just classified as homeless, would get us from, right now, I think we're at 1138 or 1238. That would get us just statistically pretty close, with like a couple hundred left over. But there's porous borders, there's at risk, and if the economy doesn't get much better, you can likely expect more to fall back into it. So,
Because the last report, I think, it was just under 1,200.
yeah,
So, okay.
Right.
All right, I was trying to figure out 450 chronically homeless, but we
And then
reduced it
there's
by
all the other-
1,000. I'm trying to get the number together.
and one of the things that the point-in-time count doesn't take into consideration is I've got two, am I down to one? No, I still have two, homeless women veterans with their kids that don't meet the definition for VA healthcare because they served between 1975 and 1990, okay? If you didn't serve more than 2 years, you're not considered VA health eligible, which means you can't get a HUD-VASH voucher. So if you ever get a chance to read through this plan, it talks about those people as well. What about the ones that don't fit that? What about the ones who have a bad discharge? You know, and are not VA health eligible? That's an issue. They all took an oath, they all swore to protect the country, defend the country, and go to war, and potentially die. They may have screwed up somewhere, and they got kicked out, but should they be homeless out in the streets? The
There's a
committee's
lot of
saying,
snapshots in time besides the one that we're in right now. You
Right.
know, they're everywhere,
Right.
yeah.
so those are some of the issues that we delved into, but we start implementation of the program in April, and I already got a meeting with everybody out in Boston, so.
I'm dying to read it.
Yeah, it's a very good, I think it's a very good plan. But again, it's only gonna be successful as we can make identification. And that's with the council on, or the continuum of care, with all the other homeless programs. That's why we work so much with them.
How much funding would be required for this?
GHCD is gonna come up with hopefully 250 permanent housing units that they're gonna build.
Yeah.
For those that just aren't gonna be caught anywhere else. For instance, Soldier On is building a property up in Leeds.
Yeah.
Okay, those are all gonna be chronically homeless vets are gonna be moving into those.
Yeah.
So that's gonna reduce the population by that amount, because everybody up there in those beds, they're called grant and per diem beds. They're all counted as chronically homeless, not all of them, I shouldn't say that. Far majority of them are, because the far majority still of homeless veterans are between the ages of 55 and 65. They're the Vietnam
married.
vets. How many married?
homeless veterans have a spouse that is also homeless with him or her?
Too many, and they're the ones that are hard to find. the reason they're hard to find is they're doubling up in, we've got another family that we're dealing with. I've got them in a motel right now, but they stay in different housing authority units, which you're not allowed to, but they got 21 days to be there and get out. They've been hopping around all over the valley, being in there for 21 days, and the wife just gave birth in the end of January. Oh, wait a second. Was it the end of January? Okay. And of course, as soon as the child was born, DCF took the child because they're homeless. So I'm working with the VA. I'm also working with the State Department of Veteran Services. They're called, I always want to call it STORM, but I know it's not. SHARP.
Sure.
Statewide Housing and Reintegration Program. Hey. So I'm working with that program. I'm working with the VA. We are looking for a place right now. Right now I got them back in a motel for a couple more weeks. We're gonna stabilize them, give them the services that they need, and hopefully get their child back with them, with all the supportive services. But first, it's a housing first model. We gotta get them a house first before we can get them all the services. So, and those are the couples, the married couples are the ones that are really together. They don't go to Soldier Run because they can't be together. They would rather be at the cot shelter or in Amherst, which there are couples out there, where one is the veteran, but they're not going into Soldier On because it's only males or females. You can't go together.
Females with children.
And, or females with children, and they have to wait for DTA to get decent housing. They're not even in the cot shelter.
That doesn't even make sense.
Well, it's the same as the Grove Street Inn.
I mean,
Right,
I
so as you go to the separate.
understand that, but I'm shocked to hear that somebody has a baby, okay, a husband, a wife, and a child, and the child is taken away because they don't have a place to live.
Right. Well, they don't want the baby out in
Well, I
homelessness.
understand that, but once they take that baby, how come that agency doesn't step in to help them find a place to live? Answer that.
Limited money.
Right.
And that's why I come in. Because that's, our plan has some of the money and the resources to make this happen. And HUD Bash is one of them. So they've already been issued a voucher, we just gotta find a place for them.
So
And they
all-
also have a dog, 2 dogs.
So there's a
It's not
million
gonna be
different
easy.
formulas, such as, so you have a veteran
Yeah,
who has a spouse
yep,
that may not be a veteran.
right. Many times the
So if
spouses.
you've got two veterans that are married,
Mhm.
there's.
They still have to separate.
Yeah, well, I've seen the details and the specifics for qualification for this new project up at the VA hospital.
Right.
And we're pretty close on that, with Broadus and a couple other guys. You don't have to, both don't have to be veterans to get in here, to get in up there.
Well, you may know more than I do. My understanding is most of the units that are being built are going to be for single homeless veterans.
Yeah.
They just had a big campaign with WFCR for their other building, which is gonna house homeless female veterans and their children.
Yeah.
So there's 16 of those units. But there's nothing that they're building that is for a couple. However, HUD Vash can do that.
Yeah.
So whatever they can do, HUD Vash, that's why the plan's good, a good read, because there's lots of ways to get to this.
Is that listed in this plan or anything? Any of this?
Yes.
It all is, okay.
Yeah, yeah, I mean, the new thing with, the women with children thing, we talk about it, but Soldier On hadn't come up with a plan by the time we had already done all of our planning. We ended that in December, and the plan had to get written completely. We then reviewed it, it went up through the chairs to the governor's office, signed, sent back down. So I was actually hoping the plan was gonna go out in the end of January, that was the initial plan. Or at the end of February, because I was supposed to do a training on it at our statewide training in Leominster, but it came out a week after the training instead of the week before, so I couldn't do it.
I'll read it before I keep hammering you.
Yeah,
Asking the
and
question.
the
I'll
most
read it and see
important,
what's
the
in
most
there.
important part, and the part to prevent homelessness, is we've gotta get the buy-in of all the VSOs. every city in town, and not just the VSO, but the town managers and the select boards, they all have to buy in. And you know, many of these people, not all of them, but many, are homeless for a reason. They've had difficulties in their life functioning. If you're saying you've been homeless and you're now 55 to 65 years old, well, there's reasons for that. And some of it is both mental health and substance abuse. We have provisions. I can deny people all the time. I could actually, the 2 homeless families that I have, I could deny them benefits according to the regulations. I could figure out ways not to help them. I can also figure out ways to help them. If we're really gonna be successful in this plan, cities and towns and the VSOs and the town managers are gonna have to suck it up and say, look, we have parades, we have ceremonies, we say anything for our veterans, well, now it's time to pony
Step
up with your budgets and say, you know what, we find all ways to deny you, but if it means you're gonna end up homeless, we have to swallow and say, we're gonna do it. Even if it's, well, you guys know about a bite on the budget, well, how many fold did I increase hours?
Yeah,
Right?
we're not too talking about that yet.
Yeah, well, that's in there too, so, but that's how, we have to convince the entire state, all the cities and towns, that it's the right cause. It's our duty, and every city and town has a duty for this, because somebody went and fought for every city and town. So if you're gonna have a parade, you better back it up,
Absolutely.
and that's my preaching, my
Along that
soapbox.
line.
Yes.
How's the Holyoke VSO doing? All right, enough said. I pretty much, yeah.
Yeah,
pretty much had a
I'm not
feeling
gonna
it was-
discuss Holyoke or Chicopee, thank you. All right,
Yeah.
so.
Holyoke VSO actually spends a lot of time in this town. In this
Okay.
town. Yeah, usually protesting, Northampton, there's too many hippies.
Yeah.
So,
Well, he's in Belchertown, so.
that's good, I'd like to see him do
His-
some more for veterans,
The
actually.
VSO in Belchertown is actually very helpful, because I've had to send a few homeless veterans his way, and he's picked it up, so.
Good, all right, well, that's, I mean, to that point, to the point about the other VSOs pulling their weight, because the consequences are, if a VSO is actually more about, parade pageantry
In saving
and,
the city or
and
town
stuff,
money.
and then lets every other community, surrounding community, carry the weight of the people who are actually struggling. See, he talks a good talk, but if he doesn't play it, if he doesn't walk the walk,
Right.
then you guys are picking up, which is good for you, and in fact, I don't think it's inappropriate for Northampton to, because homelessness doesn't know boundaries
Right.
necessarily, and that's what you know, but the fact is that, I don't know. I personally would like to apply some pressure to non-compliant or, VSOs who don't
Well,
necessarily.
I will send you all legislation that our association has introduced. I was on the Valor Act Commission to write this legislation. When are we, boss, all the time? To write this legislation that will say a VSO has to be trained, tested, and certified that they know the job, or else they're going away.
Instead of
I
a
saw that.
political position.
Right. Right,
Okay.
in other words, because there's been VSOs for years who wanted tenure. They want the state to give them tenure if they've been on the job for 3 years. Well, if a town manager came in there and went down, I always use a comparison. You don't go down to the American Legion and say, hey, what are you doing? You're retired, not doing anything? You wanna be the public health nurse? Nobody does that, right? Why do they do it with a VSO? That's not okay. So if people are actually certified, you have to be certified, then there's your tenure.
Right.
Why does a town manager or a select board or whatever wanna
Right.
take somebody down there who doesn't know the
Right.
job, when you're already certified, that you know how to do it and you're performing it?
So they're doing
takes-
that now, they're making it
We've got that
mandatory?
legislation in, and if it passes, right now, the penalty is if you don't have somebody, then instead of getting 75% back, you only get 50% back. I actually had tried to push for, instead of having it as a penalty like that, of saying, you don't get anything back until you hire somebody who is certified. As soon as that person gets certification, you're approved, then you get all that back money. but you don't get it until, so you don't get any, you get 0 until you get it, and then you get it all back, rather than
That would be
50
a
versus
motivating
75.
factor.
It would be,
Well,
yes.
Massachusetts has well, we're not alone in this, but Massachusetts is where it was invented, patronage assignments for positions, and there was a tradition of VSOs who were patronage
Right. Right,
positions.
and
who
we
were
understand,
taken-
there's a big article, a big news story on Channel 25 Boston about the state going after the VSO of a district, which is not a legitimate district, the towns of Shrewsbury, Northborough, and Grafton. All right, the 3 communities are about 65,000 people strong. The VSO is a very nice man, Dick Perrin. He's a World War II vet, 90 or 92. In his words, he's doing a damn good job, but he's part-time. And the only one of my 10 towns that have less people than he has in one of his is Middlefield, and there's 521 people. Other than that, one town of Shrewsbury, he's got 6 people on, but Vet Inc. has a homeless shelter there of veterans. Not one of those veterans gets a dime out of that town, and that's because he doesn't do it. He is gonna be in the first round of testing, he's actually says he's gonna retire. But I've already had conversations.
It might be a hasty decision, I think he's gotta think about it.
I know.
Oh, they already talked him into an extra year, he was gonna retire last year. But the 3 towns say, geez, just because our population is this, even a state rep went on the news and talked about how, just because we have large populations doesn't mean our veterans aren't being served. So I'm writing a letter to that state rep, me personally, not representing any office, of saying, give me 3 months,
And-
I'll change your caseload.
Now, if I can recall, a couple of years ago, there was, and I think Counselor, you remember this, when you brought it up about how certain cities were having difficulties with their agent.
Mhm.
People would go to them and try to find them, they could not find them,
Yeah.
so
He's a prime example.
is what has come out of this,
Right,
right?
and when the legislation came out of it. There was, and,
Meritorious, rather than a workload, it was.
well, Representative Kulik has introduced 2 pieces of legislation. Now, I like Stephen Kulik. But he's introduced 2 pieces of legislation. One, to open up the whole Chapter 115 program in the SNP and have a commission to study it. Well, they just had a commission. It was called the Hidden Wounds of War Commission.
Yeah.
What did they come up with as a recommendation? That all veteran service officers be tested, trained, tested, and certified. So he doesn't have to open it up again.
Yeah.
And also that it become, the benefits paid out is 100% from the state, nothing from the cities and towns. I understand the burden that it places on cities and towns. I do get this. I gave a speech last week at the Select Boards Association over at the Blue Bonnet. However, with the 25% buy-in, I guess the way to put it is if Brad had my job and all the money was coming from the state and all he had to do was send him a thing, then what does he care if it's right, wrong, or indifferent? The state's paying it, right? There's no investment. However, if I do it, I know I'm gonna go in front of you guys and I'm going to sit there and have to justify. Now, I get almost all of my 75% back. That proves that I'm doing the job correctly. I'm giving it to the people who need it and are supposed to get it. Now, I have local cities, aforementioned cities, that say, he's breaking the law, he doesn't know what he's doing that, da. Well, if I get 75% back, guess what? I'm not breaking the law, I'm doing exactly what I'm supposed to do. Our cities and towns, thanks to Rebecca, we are getting our 75% back in every one of our towns. So we're not breaking the law, we're not changing the law, we're not breaking regulations, we're doing what we're supposed to do.
Yeah.
So.
And we know that.
Yeah.
A function
The veteran
of
service, you guys know that.
Yeah, we're putting service in veteran services. What an idea. What an idea.
That's hippie talk.
The second thing, and I'd already talked with you guys about it, and it is on your, I didn't do it as a handout. But this is the contract. The CIC grant, we got awarded it, the Community Innovation Challenge Grant. I went in for it last November, and I wrote it with Susan Wright. And we put in, 35,000.
$316 or something.
Thank you.
Yeah.
How much was
To,
it?
35,316, I talked to her about it.
okay, and it was money to allow Hadley and Middlefield to join the district. At 1 year, their costs would be covered for the program. Plus, we put in money for new staff to help out Rebecca, a new computer, a new laptop, some cell phone money, and an increase in travel money. But it's only for that 1 year. It's just easing it in for both the town of Hadley and the town of Middlefield, because we were charging them monthly until we got a determination to then join our district. They were paying about $1,800 a month, town of Hadley was, but they'd only budgeted $1,500 for the whole year.
So where
Because
does
their former
laptop
BSO
go?
only got $1,500. What's that?
Where is this laptop? Where?
Well, that's gonna be for, our Hilltown guy, because right now Joe Russo uses his personal one
Okay.
to do his work, which is not really fair. So that's gonna be going to help him. And.
Minimal worthy investment.
Right, and there's a small line item, that's why I didn't hand it out, because I have the kind of agreement here, but one item's not in there, which is, they approved us using, I don't know, it's less than $1,000 for our Small Town Veteran Expo that is gonna be happening on May 10th and 11th. It's a Friday and a Saturday at the Covington Fairgrounds. We are having it for the purposes of, there's always the Western Mass stand down for homeless and needy veterans they have in Springfield. And I served on that committee for a number of years.
We'll get notified of this?
Yeah,
What's
everybody
the
will hear
date
about
on
it.
that?
May 10th and 11th. But the folks that live in, well, Northampton maybe, but Florence, Leeds, Williamsburg, you think about all my communities up there and all the neighboring ones up in the hill towns, they're not going to Springfield, downtown Springfield, to learn about veterans benefits. So, I've been talking about this for a couple of years, we're finally pulling it off, I've got the Covington Fair, gave us the grounds for the two days for a minimal fee. And all of that's supposed to occur both afternoons, and it's a place for veterans in the small towns to come in and find out, what am I eligible for? How do I get in the Soldiers Home? So I'm gonna have representatives of the Soldiers Home there, I'm gonna have representatives from all the different fields at the VA are gonna be there, I'm gonna have people from the Department of Veteran Services there. I'm going to have Tapestry Health, everybody's gonna have a table to, just for people to get information. If you're a veteran, surviving spouse of a veteran, or you're just concerned about your neighbor who's a veteran, you can come to this and you'll be able to learn everything you can.
Yeah, that's great.
Snow might even be melted by then.
You better be. Yeah, better be.
Well, all coming tonight.
Yeah,
So
so
anyway,
that's our CIC grant.
will you be coming to city council to an open
Yeah,
public
'cause-
session to talk about that?
Well, I
Because I
will on
think
the
that
same
is-
day that I come to you. On my
Because I
next
think that
item.
information is so valuable.
I included, this is our VS6. And what it is it's telling you pretty much what benefits we're gonna pay out in the month of March. Okay, the reason I included it, it says 60,100. I haven't had a chance to double check with Susan Wright, but she's putting something in front of the city council for an increase in my benefit line. Because that's the month of March, I've only paid probably 2/3 of that money out. But in my budget, I'm left with $87,200 and something dollars. So I'm gonna have to come to get more money to get me through April, May, and June.
Is that
just
this
how-
meeting, Thursday?
That's why I prefaced it by saying, I haven't talked to Susan yet to find out. So if I'm supposed to be there on Thursday, then I will come.
Not on the agenda.
I don't
Okay.
think you're on the
You got
agenda.
until tomorrow to get on the agenda. So.
All right, I will double check with her. So it's either this Thursday or the following city council meeting. I'll have enough money to get me through the end of this month, but to get through April, May. I have another, I I think I've got 10,000 on 2 other line items that's also under the 115 reimbursement that I'm predicting will not be spent, so I can move that. That'll get me a little ways. So if it's not this meeting, it's not urgent, I'll just do it
I
at the
haven't
next
seen
meeting.
it on the agenda.
Yeah, so we'll just do it the next one, but I just want you to know that we're spending about 60,000.
But
The
like
good
Bill
news
said,
is-
you do have till tomorrow.
Right. I will double check with Susan to see when she wants to do it. But I can tell you that, out of that 60,000, I would guess that probably anywhere from 8 to 10,000 of that is gonna be at the 100% reimbursement. That fight that I had for a few years and I finally got it in August.
8 to 10,000 of it?
Yeah. I mean, that's just me talking out my head, but I think that's right, because we have been helping a lot of, people get housed, and that's all at 100%.
Under your miscellaneous, just off the top of your list, a few.
Miscellaneous could be anything from those people with HUD badge vouchers who need to get into a place,
Yeah.
playing first class and security, to people who have, Medicare reimbursements, to people, their health insurance, all of that, that all comes under miscellaneous. There's about 14 things that fit under that category.
Nothing for office expense or anything like that in the miscellaneous? Or is
Oh,
there?
gosh, no.
I didn't
No,
think so.
none
Okay.
of our operating ever fits into this. This
Okay.
is strictly money that we pay to the veterans or the surviving spouse. That's all
That
is.
should be, that's a good thing,
Yeah,
because.
I want everybody
It's
to
very
know that.
simple.
When you look at
It's very
miscellaneous, I want
simple.
everybody to know it's not office expenses.
Yeah, and the other thing you guys will see in this year's budget proposal is we broke it out. There is going to be some line items that are exclusively just the city of Northampton. And then there's gonna be line items that is our payment into the district, our part of what we pay in from the other, as well as the other cities and towns.
Okay.
So it'll be separate this year, rather than it looking like it's all just Northampton.
What's the medications?
Oh, if people have prescription, and they have co-pays, we cover their co-pays. So if you get $5 on every drug that you get once a month, we give you the $5 back.
And that's for visits too.
Yeah, that's for doctor visits, that's for everything, yeah.
Okay.
Geez, you know, I can't even go to the dentist for less than that myself,
I know.
$167.
Tell
Hey,
me.
now we get to, I know we're getting into number 3 here.
Yeah,
Um,
right. And this was at the last time that I was in front of you folks, so
Yep.
you weren't able to be here, you had
Yep.
questions about
Yep.
what was gonna happen with the 9C cuts. I just included the letter that I sent out to our membership of MVSOA, thanking the governor and the Secretary of Veteran Services for, they returned some money, but none of it was in veterans' benefits. It
Yeah.
was some money that they had for monuments that they said they were gonna help build and da, da, da.
plaques and things that,
Right,
yeah, I saw
so they
that.
said, look, if we're gonna give back money, this is where the money's gonna come back from. It's
Yeah.
not gonna come from the benefits that we provide our people. So I was just so you knew, I included it so that you knew what ended up happening with the 9C cuts. Nothing came out of benefits.
You know, I mount a lot of those little plaques in different places.
Right,
And, so anyway,
yeah,
I got calls.
yeah, and.
So now it's all volunteer. so-
Yeah, it's unfortunate, but,
Yeah, I know.
but
But
that's,
I'm happy to do it.
yeah.
I'm happy to do it, yeah.
And my final item, oh, I did it.
You did
I'm
it.
sorry. Yeah, so that's what's going on. I'm working on a grant, I'm working on the homeless program, I'm working on the HUD Badge State program. I'm still a part of the Western Mass Network to end homelessness. At the state training, I had the lovely honor of standing up and defending sex offenders, which wasn't really what I wanted to do, but I'm on the subcommittee for Western Mass and on the statewide committee for veterans who are sex offenders. And how we don't have to like it, but it's a lot better to know where they're living
Yes.
and house them so that they're stable and we can check on them, rather than having them homeless and hanging out on playgrounds. And the reality, I called out a guy from the other side of the state. Like I say, it was kind of uncomfortable having to defend, but he was like, I got a level 3, I'm not gonna have some pedophile on my benefits. And I just said, well, really, there's no way you would know whether or not he's a pedophile or what. Level 3 means is that he is very likely
To reoffend.
reoffend. Now, there's a guy that I know, and he got level 3 because he has a habit of being out in public and defecating. There's a high probability he might do it again.
Yeah.
Yes.
That's a sex
That
offense.
reads.
Right. So, is it incredibly distasteful? None of us want to see it? Correct. But he's not a pedophile, and I'd rather have him have his own apartment so he can go in the toilet rather than out on the street. So, you know, it's a weird position for me because I don't want to be the one, but I think it's a public safety issue.
And it is.
And if they're a veteran, like I know another guy who was a level 3, and that's because he was 19 and he had sex with a 16-year-old girlfriend, and the parents had him arrested, and then he ended up going to rock, so he didn't report. So he went from a level 2 to a level 3 because he didn't report. Now he has to get lawyers to get it back down. So just because they're a level 3 doesn't mean they're pedophiles. They could be, but even if they are, I'd rather have them in some place.
There's many ways to get on that register, you know,
Yeah.
even level 1, like, such as solicit prostitution.
Yeah.
Gets you, gets you
Oh,
arrested.
public urination. If we
Public
see somebody
urination.
right there and the police arrest him,
That's a level 1.
he's a level 1 sex
Level one,
offender. Unless the board decides, well, it's a good chance he's gonna do it again because he loves to drink, and if he can't make it to a bathroom, he might do it again. And that board, and I met 2 of the people who do that rating,
So now the homeless alcoholic is a sex offender.
right, and then I can't house them because they'll do everything except house sex offenders.
I think it's about 2/3 of the UMass enrollment.
That's why the average UMass police go, I don't see anything here.
Yeah.
Yeah.
Processing
Well,
level.
that's what happened on my ward,
Mhm.
okay, which took, because I worked with the city very closely in the police department with a sex level 3 and a 4. And it was a long story, and I'm not gonna go into it, but we had to do what we had to do. The whole street was in an uproar. And, you know, even the grandchildren and children out there, it was not a healthy situation.
Right.
But we went to court. I went to court with the city, and it worked out fine.
Yeah, like I say, it's a public safety issue, it
And it
really
is.
is, and
It was
everybody, in my opinion, if you served, you deserve a roof over your head. That's all I want to say. Okay.
Okay.
I want to thank you, Steve, for
All right.
everything that you've been doing, and I hope when you do come to city council, you do mention about this occurring.
Oh, the Small Town Veteran Expo, yes.
Yes,
I will.
please.
I'm gonna be going to all the towns and talking about it, and we're gonna be getting it out. And there's gonna be invitations going out next week. Just got the letterhead done. I had a friend who's a graphic designer, he did a great, logo for us, so. And if it goes well, the VA wants to do it annually, so.
Because there's so many veterans out there that really don't know what's available. They'll say, I don't have anything.
Right, and
I can't
if
get
they're in any of
anything.
these towns between, you know, the Pioneer Valley and the Pittsfield, all those Berkshire communities, they're small towns. They don't know unless they get it from word of mouth. That's how, you know, not one case existed in any of the towns before we took it over. Now every one of them has a case. At least, so.
Steve, thank you.
Thank you very, very much. And
Thank
I
you.
wanted to ask you, Steve, do you
Yep.
want to come the month of September or October?
Vance.
Because I know I'm going to ask the Veterans Council if they would like to come in September, because I know there's a lot going on that you'll be bringing forth to
All right,
us.
what's the date in September?
September would be September 16th at 5:45.
I can do that.
Okay.
Brad, I want to thank you for the hot dog and the heat.
Did it help you?
Yes, it did.
Is that at 5 or 5:30?
Right, and hot
That would
dogs
be
too?
at 5:45.
5:45.
You had hot dogs too?
Because I have Grace House coming in, not unless you want to come in and sit
Yep.
around.
I missed all that.
Delivered,
In a brand new heated GMC Suburban.
big tank.
As long as Gazilla didn't run me over, that's
You
all that
should have
matters.
seen it.
Yukon, I had 4.
Big Yukon. Suburban.
Was it?
whatever the heck it was a
Was it
big
you
carnival.
guys who were, setting off the car alarm or
So
something?
you're all set with that?
Yes, yeah, there you go. Yeah. Do you like how we did that? They did that.
I know. All right, so I'm gonna open it up to the Northampton Veterans Council and Brad LeVay, who's the president. I wanna thank you for being here. Tim Daly, thank you for being here. And Norbert Ricky, thank you, who's the secretary of the Northampton Veterans Council. Jerry Clark could not make it. Brad called me this morning and I appreciated that. And Brad, we're gonna go ahead and let you take over.
There you go. Well,
Wait.
thanks for coming, Brad. See you
Anyway,
later.
Nice to see you. All right.
Brad's job is done. It's,
Tim Daly's with us tonight.
I saw that.
He's the vice president, and he's chairman of the activities committee. And here's a list of all our activities for the year 2013.
This is the one that's gotta be
And
scanned.
if you got any questions,
In
or
our
Tim can tell you anything
next
about it,
minutes coming up.
feel free to.
Well, we checked off the first one.
We got the first one all done,
Yes, we did.
One down.
and it was very
And,
successful, and we really had a good time.
This is the letter that we used for our last regular meeting this past month. So it says proposed. It's all been voted on, and these are the activities and the dates that we are gonna use. Because of the organizations and the city of Northampton and the VFW, the Elks, the American Legion, last year we burned almost 5,000 flags at this flag
Yes.
ceremony.
Wow.
Well, we decided that rather than spend a day and a half doing it, we're gonna do it every year.
There you go.
So this year, it's gonna be, Jim Coyle is the chairman for that activity. And it's gonna happen at the American Legion parking lot. And it's, you know, it's formal as far as regulations by National Flag Code and everything. But it's not something that's open to the public. It's
Right.
just, there'll be veterans there, there'll be Sons of the Legion there, there'll be, our council will be there. And, that's our plan.
And you don't expect it to be that many flags now, because you wouldn't have that backlog that you have.
Well,
They haven't seen
I will bet that we'll still burn 2,000 flags.
Really?
Wow.
yeah.
That's from
We
all
got-
the cemeteries.
That's from all the cemeteries.
You got that right in St. Mary's.
We usually wind up, from, Mr. Demon with the big flag from Northampton High
Right,
School. We
right.
always wind up with a couple of those.
Well, and our flags
And,
out here only last
Yeah.
6 to 8 months.
Sure.
The
So we have to
cemetery
replace that.
flags,
And
the
the privately owned.
and privately owned, you know. If you have a flag, you
That's
bring it to the Legion, or bring it to the
Yeah.
VFW, or drop
I
it
think
at
that's
the
for the
Elks.
public education part, so the
Yeah.
public knows where they can bring their flags.
Right, there'll be an announcement in the paper.
Mike Beeman knows, and
Oh, yeah.
all those guys know, but,
Yeah.
yeah.
We actually have one flag.
But there's
that's out
people,
50
there's
years.
people that have been bringing flags to the Elks for years. They've been bringing them, they know they can go to the VFW, or go to the Legion. And I know Steve's got a closet full of them over here.
We get people who bring them back.
They'll bring them to the, you know, so that's taken care of.
And that is open to the public if somebody wanted to stop.
If somebody
and see.
wants to
Right.
stop and
But
see
we're not-
it,
You're not gonna chase
We're
them.
not
We're not-
advertising it, you
You're
know.
not inviting people to come.
When you
That's
see
right.
that smoke, it'll be like the Pope, you know?
Right?
See, the
Yeah.
oil.
Is it
white smoke?
Is it white smoke?
Yeah, see?
those nylon flags they give off like
Yeah.
this black smoke.
Sure they do.
Ooh, last
So
year.
the actual ceremony time would be the 9th.
That was,
June 9th.
Well,
That's the ceremonial one.
the Flag Day ceremony, will be at the Elks. Let me continue down through this.
All right, now wait a minute, we're jumping, we're going from.
Well, I
That
know
was my
that.
fault, I should have shut up.
That's his fault. Okay, our next event is the Leeds Memorial, which is the 26th of May.
Mhm.
And then our Memorial Day in Florence. And I've been requested by the Activities Committee to ask you if you would like to be our Memorial Day speaker at Lawrence.
I would be honored. Absolutely honored.
Thank you very much. And, the Flag Day at the Elks, we really didn't have a great turnout last year. I'm hoping that with a little more publicity, we can get a good turnout this year, because, the Elks went out and they bought hot dogs and potato chips and everything, and it's all free and open to the public, as long as, you know, they were part of the ceremony.
Did
They
you
bought small flags to pass out to the
Right.
kids, and,
Those weren't the hot dogs you fed the Gene.
last year.
Last year's hot dogs for.
June 9th was my anniversary, by the way.
Yeah.
Oh,
30 years.
so bring Peg.
I intend to.
And then, for the last 3 years, the Veterans Council has participated with the Pulaski Day Parade. And they are members through the Polish Heritage of our Veterans Organization. So,
They're planning a big do this time.
Yes, they
Jerry
are,
Butler
because
was
of the-
out recruiting bands at the parade.
right,
Yesterday.
right,
He was literally, he was hiring bands like Framingham and other, like, so he's-
yeah.
Well, it was quite a
They
thing
had-
last year.
Yeah,
Last year was a
Yeah.
big parade, but
That was
it was huge.
I think it's an anniversary this year of
something.
It is
that
something.
they've done it, whether it's
Right.
50 years they've done it, or,
It's a long time.
yeah.
Yeah.
So anyway, that's,
They're gonna have to move further down into Pulaski Park if they're gonna get that big.
Well-
Yeah, it's gonna be, we're gonna be doing
Because
like
we
the
can't
forest
hang out
parade,
right
we're gonna
there.
start doing the circle, you know,
Maybe
we're gonna
there's-
circle up around
Yeah.
Smith and come back down.
yeah.
Cause of break, so we'll end up biting our tail.
The annual Salute to Veterans Breakfast will be held at the Elks. And this is the first year we got it on the same weekend as Veterans Day, because we got to Seth soon enough. So the breakfast is gonna be on the 9th. And Jerry Clark and myself and Zach and John Glenowitz from the Elks, they're gonna be a part of our committee for that event.
Well, Veterans Day is gonna be a Monday holiday this year.
And Veterans Day is on Monday,
Never holiday.
and I think moving Veterans Day into the park and keeping it out of the front of Memorial Hall. You know, a couple of years ago there, I really had a scare with a little kid out there and cars flying by, and, you know, and I kind of said to the committee, I says, we ought to move this into the park and get the people off the road, off the street, you know?
And not to sound too selfish, but it's freezing.
It is.
In the
freezing
front
out there
of
'cause
Memorial
of
Hall,
wind.
there is
In the
nothing
front
but
of
shade.
Memorial Hall.
Shade and wind.
And of course, those metal chairs help. you
Yeah,
know?
exactly.
Was it a few years ago when Michael Ryan was speaking?
Uh-huh.
His jaw couldn't even move, he was so cold.
Yeah.
His cheeks were full, he was trying to speak.
You know, Mike's had a stroke,
Yes, I understand.
yeah,
Yep.
and he's lost about half vision in both his eyes,
I didn't hear that part.
Yeah.
No.
yeah.
Tough shape.
Yep.
Mm.
Ugh.
I had asked him to be our speaker at the Veterans Day breakfast, but we'll hunt another speaker now, I guess, unless he comes through. Pearl Harbor, you know, we were asked to participate by East Hampton a year ago. So, 2 years ago. So this past fall, Brad and I went over to the East Hampton Legion, and we talked to them and asked them what their plans were, and we would like to participate if they wanted us to participate. Well, we wound up doing the whole damn thing. So,
Yeah, careful what you ask for.
you know? So this year I've asked Steve to work through the VSO in East Hampton
You do it.
and let them come up with a plan, and we'll support the plan.
The reality is when that bridge got dedicated,
I remember
and
that.
when it
Yeah.
got fixed,
Yeah.
there was a dedication.
Yeah.
I got a call from the State Department of Public Works and from, representative, from Senator Knappick's office. And they said, can you work with East Hampton to put something on? And I called up East Hampton, I called up the American Legion, VFW, and VSO, and they said, yeah, whatever you wanna do, we'll be there to support you.
Yeah.
Support us.
So I put it on, and we did it, it's basically gonna be on us.
So,
We have a functioning Veterans Council.
yes.
Tim,
They don't.
how do you designate your speakers?
We have a meeting.
We have a committee meeting. I have 8 of the Veterans Council on the activities committee. And we hash around names and we ask speakers. So that's how we've been doing it. I don't know if anybody has a suggestion for a speaker. We're more than willing to.
Who did it last year, Steve?
Dave Markowitz.
Yeah.
Yeah, Veterans Day,
He
right?
did.
Yeah, he did
Yeah.
pretty good.
Right, because I
Because he
I was
got-
at the State House.
Well, Gene remembers how he got nailed for that at the St. Patrick's. He came for corned beef after the parade,
Yeah.
and I grabbed him,
You know, we're open
and
for names if anybody.
It was honored, it was perfect.
oh yeah, and he was very, very happy.
So you're not gonna have the mayor do it again?
No.
No, it's nice to have
We try
somebody
we
else's
try to
perspective
rotate
every
the
year.
speaker,
Yeah.
and
the
the
issue is
mayor
to make
always
sure-
has his proclamation anyway,
Yeah.
so, I mean, he does have a part.
Yeah.
I have a couple more items I'd like to get through here. The Veterans Council has purchased 200 thank you coins. You've seen the coins that we have with the seal in Northampton.
Yep.
And on the back of this coin has all the branches of service. And it's a thank you commemorative. We've got guys up at the Florence Armory, and once we get the coins, we're gonna make arrangements to do the presentation to the, I think there's 18 of them.
Yeah, 18.
Up there. And then, what we wanted was to have a coin that was from the Northampton Veterans Council that we could pass out, like, if we have a homecoming for a veteran or one thing or another, be able to say thank you and hand you a coin.
And this coin has all 5 branches, so it doesn't matter.
So it's, we tried, you know,
Like
we
a
had,
challenge coin like I have here.
Okay.
we had coins for Korean War vets, for Purple Heart vets, you know, so. But what we decided that we would do is, we would do a generic coin with all branches because it saves us some money. And the idea, we already have paid for the stamp for the Northampton seal, and they have this logo on the back.
Yep.
They have that stamp, so we didn't have to pay the $300 to have.
For a setup fee.
For a setup fee this time. So
Excellent.
that worked out.
It's a good idea, hell of a good idea.
Our next regular organizational meeting will be a week from Thursday night at the Elks at 7 o'clock, if anybody wants to come. And I think that we've worked hard to keep this Veterans Council together and to keep it active. And I know Steve appreciates the fact that a lot of the things that became his tasks are now put off on us, and we don't mind doing it.
And I'll tell you, I have a lot of communities, and I've dealt with others, and just like we were talking about our neighboring cities, they don't have a real functioning council whose objective is to really promote and provide ceremony and support for all these things to go on. And so these guys have made me very fortunate, but more importantly, have made the city very fortunate to have them on.
Well, actually, he did more than that. It actually reflected very well on the city.
Right.
I mean, I think, you know, you guys have done, you've surpassed every other division that I've ever seen in this score. And that's, you know, without a lot of heavy lifting on our part, makes us look damn good. So for that, we're great,
Yeah.
to be sure. And but it's more to the point of what you referred to, is honoring service. And that as opposed to paying lip service, right?
Right.
And that's the thing that, that gets me back to
Yeah.
my issue.
You get me
Mr.
going
Franco
again.
and
I'm
stuff.
not-
But but the Hilltown,
I'm not,
my deputy VSO, Joe, is really trying to get the same thing happening up in the hill towns of our district.
So I bet you
To
get
get
some
them-
good feedback with that, I think.
Yeah, yeah,
I
he's
know some
trying,
guys in Albany.
they're starting to meet, and they're starting to
Yeah.
get along, and to share responsibility
takes-
like we have.
it takes, really, it took us a good, when the group that we have together now, the first couple of years, the only thing we did was the parades
Right.
and the breakfast.
Right.
And that was it.
But that was still a lot of my plate, because I
Yeah.
was
And-
to do it.
You know, as things have come along and the committee has become more active, we've been able to participate in a lot more.
Yeah.
I mean, if you had told me 2 years ago that we were gonna raise $26,000 and take 54 veterans to DC for 5 days,
Yeah.
I would have told you were crazy, But yet, we pulled it off.
Well, the other really important service that you guys perform is you're aware of what's going on in programs that are being advanced and programs that are available for veterans.
Right.
And,
That's right.
and you're better than Facebook as far as that goes, sort of broadcasting these things and getting to the people who actually need the services.
That's right.
You can have the best VSO imaginable, and present company accepted, and then if there's no council backing it up, if there's no veterans,
Exactly.
I was in the
Advocating.
Big Y, and a lady came up to me and she said, "Are you Brad LeVay?" And I said, "Yes, I am." She said, "You're with the Veterans Council?" And I said, "Yeah." She says, "I have a problem. I don't know if you can help me." I said, "I'll certainly try." She'd been trying for 10 years to get a veterans plaque on the ground. I call them a footlocker.
Oh, you gotta be
The
kidding.
government.
Yeah, the bronze.
And I said, "For 10 years?" "Yep." She said, "I wrote letters to Washington DC, I received letters, and I can't get a marker." I said, "Was your husband in the service?" She says, "He spent 4 years in the Korean War on a ship. And he went overseas and blah, blah, blah." So I took her name and everything else. I came down to the office, and Norbert and I got on this case. And through that conference with her, we ended up with a plaque on the ground. I go into the Big Y today, and she works there.
Oh, I know who you're
She
talking about.
runs over and gives me a big hug. I'm the greatest hero I've ever put. 10 years, she goes up there every day, she said, and looks at me. So, you're
Unbelievable.
right, Bill, it does rub off, because I have a lot of people talk to me about stuff like this.
And that's why we're having
And
the
I
small
send
town
them right
veterans
down-
expo.
Right.
Is that
There you go.
very reason.
That's
Send them
Because
right down to
people-
the office.
Yeah,
It's,
because sending letters to Washington isn't gonna get you.
They're not
No,
gonna get
you're
it.
right.
No, and I'd imagine there's families and veterans in
There's
Ohio who are
other
frustrated
widows
with
out
it.
there, Bill, the
Yeah.
same way, they don't know what's going on, they don't have the,
No
Yeah,
point
like
of
you
contact,
said.
who do you call?
nobody to tell them.
Well, I give you a perfect example of that. I went to the assessors because I was finally given my disability to get my property tax reduced. And the girl there that's the secretary for the assessor, she says, "I'm not sure what regulation, I'm not sure what," and I says, "Just a minute." I walked out in my car, and I walked in, I handed her, and I says, "This is the Veterans Disability Manual. This will tell you everything, from property, excise tax, I mean,
Did you let her keep
you
it?
know." And she's looking at the book and she says, "We have a veterans agent. He never showed us anything like this." She says, "Where did you get the book?" I says, it doesn't really matter, you got the book now. And she told me that, because I had to take my excise tax out the other day, and she says, we've had 20 veterans come in here since this has happened. Well,
But doesn't it go by your income?
Nope,
No,
nope,
Because that's what Joan told me on the phone.
no,
no, there's certain ones that, actually, none of those real estate tax abatement has anything to do with your income, it has to do with your disability.
your disability.
Oh,
And your
If-
rating.
disability.
If you got 100%, you get $1,000
Right.
off. If you got
But even if you're a
80%, you
veteran
get
without a disability,
Yeah,
it's
it's
useless.
incremental, yeah.
You can't get anything.
Well, you, when you get discharged, the state gave them $300.
Now it's 1,000.
Now it's 1,000?
No, I'm talking about if you're a veteran who served our country,
No.
okay?
There's no real
You
estate
don't
abatement.
get any
No,
kind of
there-
exemption.
No abatements.
You
Nope.
just get the I guess the city of Northampton has that over 70.
Yeah,
You-
there's,
you
Yeah,
That's it.
but it
$400
still goes,
Just
it
circuit
goes
breaker.
by your
If you
income.
have a disability, blindness,
Yeah.
you
Right.
can get it.
Yeah.
I can see that.
You
Yeah, I mean,
Steve.
No,
Service
it's-
connected
Tell them I had a long
disability.
day.
Yes.
It's put a lot more,
Reverting back to your old profession.
it's put a lot more, aware veterans out in the community because
that's the,
you're always
that's the
getting,
thing, that's,
you're always
that's,
getting asked. you
that's
know?
the thing, I mean, what do? You look up, if you're in a community that doesn't have this, you look it up in the phone book, you're gonna be sent to the feds.
Yeah,
And you're
Yeah.
you're
Yeah,
gonna
you're
talk to
right.
a robot.
and you're not gonna get
You're never
anything
gonna
out of
get
it.
anything, you're gonna have that same thing.
Talk to
Here-
somebody in Hong Kong.
Exactly, here you're talking to someone on the ground, someone like you guys who can make the case, know the avenues and the doors to open and knock on.
Right.
It makes a huge difference, and it's not one that's really immediately visible or appreciable. But the fact is that clearly it manifests as a benefit for the community, because the people who live in the community and also a reflection of the way we present ourselves to the world at large.
Well, I would say, in all honesty, in November is not the nicest month of the year to do anything. But I would say in the last 3 years, the parade route and the ceremony in the park and everything, we've probably tripled the participants.
Yeah.
I believe that, I believe that.
And especially Memorial
I
Day
do.
has.
Oh, yeah.
To
Memorial
which,
Day up in Leeds.
oh, it's building.
Yeah.
Yeah.
Man.
I remember when you half
Okay.
dozen people.
I want to thank you all for being here. Thank you, Steve. Thank you, Brad.
Hey, Steve,
No,
I'll leave a chair up for you.
And if you're trying to call Washington
Brad.
now for any types of
Before you
numbers.
in the
leave,
market for computers,
how
for
about
computer,
You got me already booked.
for
iPad,
which month?
I'll tell you in a second.
with this keyboard, it doubles as a case, if you get it with,
Yeah.
when you get, 3G reception, you can get it anywhere in a house.
Yeah.
Stuff like that, so there's a need to have Wi-Fi, because there's not a lot of Wi-Fi.
Yep.
Anybody want to
Yep.
plan?
That the genius seems to be pulling out of general things.
Short forward statements.
Yep,
so that
no
when
problem.
they're introduced, you know.
Yep, thank you.
Okay.
Yeah, be an honor, thank you very much.
Alrighty.
Gentlemen,
Oh,
Norbert, thank you.
Gentlemen.
Brad.
We'll see you folks.
Tim.
Alrighty, hey,
Thanks
thanks
a lot,
for
gentlemen.
coming.
Yeah.
And thanks for everything you guys do.
I think, Norbert, it could be for the,
Call it.
So they got another meeting coming up?
Yeah,
oh,
this is
it's
parking.
you got a cold, yes,
parking
cold,
thing.
I'll go with
you
that.
can call it tomorrow too.
Yeah.
I'm working with Brad.
Okay, good.
Thank you.
Very good.
I heard the name.
I did too.
Hear the name. Come on.
So, what's September?
Everybody have fun, everybody like Chung.
Yeah,
Oh, yeah.
I thought I went through this.
yeah, I wanna make sure.
Oh, I moved that we adjourn.
No, I'm not finished.
Okay. I moved that we,
Don't laugh,
so,
Eugene.
so you're withdrawing, you're not accepting my motion?
No, I'm not.
You must have that down.
That's the material for.
I just wanna make sure.
Yeah.
Okay, you're all set.
Hi.
We're set, right?
Because I had you down also for
I went right through the whole year.
October.
I know.
Oh,
I've been watching.
okay, good.
Okay?
Yep, thank you.
Yep, thank you guys.
See you, Brad.
Thank you. You
All
don't
right.
forget, you're gonna speak at Leeds.
Yep, yep,
They wanted you up there.
okay, no problem, thank you.
Yep.
Okay, now, we have no public comment. New business, we're gonna talk about, the month of, let's see, April. And I have Meredith O'Leary coming in, who's the Director of the Public Health City of Northampton. And this meeting is only strictly for 1 hour because we have ordinance coming in.
Yep.
Because we
Yep.
haven't changed the date on it. Okay, Bill,
Okay, I move that we adjourn.
Second, aye.
all in favor?
Aye.